It's something nearly all Canadians agree on. Canada's long-term care system needs fixing. But a new Angus Reid poll shows that while 75% of those polled think the system needs significant change, only 1 in 4 believe significant change will happen. Experts in long-term care say that cynicism is well-founded, as successive governments have known about these problems for years, but done nothing to fix it.
People don't like to think of themselves going there, so we want to forget about it. We don't want to think of it as someplace I'm going to go. I have so many friends who say, well, I'm going to get old in this place I'm in. I'm staying here forever. But hardly anybody plans to go into long-term care.
Pat Armstrong has studied long-term care for decades. Last year, she co-authored a paper outlining things Canada could do to address the situation. However, few of the paper's recommendations have been implemented. Among the recommendations, a call for for-profit care homes to eventually be phased out, a suggestion that polling shows is popular with around 60% of people.
Right now, about 50% of long-term care is provided for profit. I can't think of a way that we can untangle that will actually provide help for an aging population. Governments are not going to put the tens of billions of dollars into it.
CanAge, a seniors advocacy group, says making public a sector that's nearly half corporate-owned would be a big ask. Instead, they feel Canada should implement something similar to what's planned for childcare, a federal transfer payment contingent on the provinces coming into line with federal long-term care standards. It's a bone of contention. The provinces assert long-term care is strictly within their purview, but Armstrong says putting cash on the table would change their minds.
The for-profit model is incompatible with all healthcare, and I will stand on that for the rest of my life. There is no question that for-profit operation in long-term care has been the cancer in this sector, and it's not lost on all of us that have been paying attention that the worst outbreaks, the highest COVID-19 mortality occurred in for-profit homes, particularly in Ontario, where we have the largest share of for-profit ownership across Canada.
However, Professor Vivian Stamatopoulos says not only is making public long-term care in the public interest, it could be easy. She points out Rivera, one of the largest for-profit care home operators, is already owned by the federal government, but not run as a non-profit. Stamatopoulos adds that we already have models for well-run long-term care homes.
We have a existing and substantial body of literature that demonstrates how substandard the for-profit model compares to, for example, the municipal ownership of long-term care. And that's really where the evidence would suggest we need to move. We need to phase out for-profit. We need to look at the models that are succeeding comparatively, and that is the municipal, public ownership, really.
However, the window may be closing rapidly for Canada to fix its long-term care system. Watts says in Ontario alone, there are 46,000 seniors on the waiting list for a long-term care space. In Ottawa, Xiaoli Li, City News.